Ayubowan. Today we are going to talk about a very interesting new topic which is related to men's health. This is about erectile dysfunctions. Yeah, this is a very interesting topic. Maybe the community, especially the society, men who don't want to talk about this much. So yes, today we are going to talk about this concept with our guest speaker, Professor Ajith Malalasekara, consultant urological surgeon. Welcome you, sir, for the interview. Professor, I would like to know, what is this erectile dysfunction and what are the causes for it?
Yes, erectile dysfunction is a situation where a man during sexual function has difficulty in achieving a hardness of the penile organ so that he cannot have satisfactory sexual activity with his partner. Actually, this is a very common scenario that is there out in the population, be it in the young or it may be in the old age groups. But the key factor is that a large number of these patients, maybe it's due to being shy to discuss this, or it may be sometimes that the doctors don't want to or feel embarrassed to discuss this. They don't come to seek help to a hospital. So the first problem is that people don't seek help.
Yeah. So according to the description from Professor Ajith, I would like to know furthermore about this. What are the causes for this, Professor?
Yes. As I said, erectile dysfunction is quite a common problem. And there can be two wide divisions of the causes. One aspect can be psychological, and that is we find commoner in the young age groups. Not that it is not seen in the old age groups also, but as a primary cause, it is probably commoner in the young age groups. As we see older patients, the importance of hormonal problems, the male hormone testosterone, then the problems of nerves getting damaged. In older age groups, we find diabetes is a very common and significant cause of this. Then, of course, blood vessel problems. And for this, again, diabetes causes a lot of impact. Cigarette smoking, etc. Are some of the main causes that lead to these erectile dysfunction.
Yeah, so Professor has explained more reasons for this thing, what is this erectile dysfunction and what are the causes for it. For the benefit of our viewers, furthermore, I would like to know from you, Professor, so what are the treatment options for this erectile dysfunction?
I think probably since 1998, when the beautiful blue pill called Viagra came out in the public, there has been a lot of interest even among the public in getting treatments for this. And so that is one of the simplest forms of treatment. The sildenafil, tadalafil, vardenafil type of tablets that patients can take as and when needed or on a long-term basis. So tablets are there. About 45 to 55% of patients will respond to these type of treatments. Then, if they do not respond to these treatments, we will have the options of moving on to more invasive kind of treatments. Some people can utilize certain vacuum devices which are available all over the world and even in our country. Then there are methods to inject into the penis directly to stimulate erections. Then there are other methods which we have in our hospital as well, the low intensity shockwave treatment for erectile dysfunction. Aside from that, of course, we stress on our patients that if they are smoking, they need to stop smoking, they need to control their diabetes, they need to control their diets, start exercising and get into a good healthy lifestyle. Of course, the psychologically challenged patients who may be depressed or having a lot of anxiety, we can get the help of our colleagues, psychologists, psychotherapists, psychiatrists, etc., to help them in these aspects. However much we try, some of the very advanced disease patients and who have very severe forms of disease, it may be some sort of new nerve problem or blood vessel problem, will need a most complex form of treatment involved in erectile dysfunction, that is the penile prosthesis insertion.
Okay, so we came into the juncture that we are talking about this important surgery which is performing in lung hospitals. Actually, they has achieved this performing surgery for a while right now. So as far as we know that Professor Ajith is performing these penile prosthesis implantation surgeries for some of the patients. So would like to know, what is this penile prosthesis implantation and what are the benefits and what are the risks of having this surgery?
Yes. So, Dr. Asari, as I mentioned to you, this is not the first line treatment. This is for patients who have not benefited from, for example, taking tablets or other forms of therapy or psychological treatments. So it's maybe a small percentage of patients, but who have failed on other forms of treatment. That is the first criteria. Then the other main advantage of this kind of treatment is that I mentioned before also now, for example, the patients who take oral tablets, the failure rate in those patients may be more than 50%. So there is a lot of patients out there who have actually come to us doctors, tried some treatment and have failed. And in these patients, in this small group of patients, that is where penile prosthesis insertion plays a very significant and very beneficial role. This prosthesis surgery has been there since probably the 1970s internationally. It's been there a long time. And the main thing that I look back from the 70s to now is that the advances in the technology related to these penile prostheses, they have become better as far as trying to simulate the actual erection a man will obtain. They have tried to combat the problem of infections that can happen when we do this surgery. And of course, because this is now getting accepted more and more worldwide, and also maybe in some way in Sri Lanka as well, the cost factor is also slowly coming down. The more number of products being sold out there, obviously the cost will be less for the individual patient. So getting back to the benefit and the results, so to say, the worldwide statistics that are there regarding penile prosthesis basically says that if the patient has the surgery and manages to avoid the complication of infection. Why do I stress on infection? Whenever we put a foreign body into a patient's interior, there is a risk of infection. It may be a cardiac stent, it may be a hip prosthesis, etc., etc. There is always the risk of infection, but with the latest technologies, the latest precautions and the antibiotic profiles that we use, the infection rates in this patient is almost less than 1% in the properly selected patient. So if we avoid an infection in these patients, we know that the satisfaction rates among the patients and the partners is in excess of 90%. That data is out there for anybody to go and see in research papers that have been done worldwide. So yes, it is a surgery that might take maybe 1 hour, 2 hours maximum, with a very small incision that is made in the region of the male organs. and it can be done under a spinal anesthetic, and the hospital stay ranges from a day to 48 hours, and maybe a little bit of rest at home, again 10 days, 14 days, and that's what basically the surgery entails. And after 6 weeks, generally the man is able to use this prosthesis, and if there are no complications at that point, the statistics from worldwide literature and from our own experience in Sri Lanka, we know that majority of patients beyond 90% will have an excellent outcome with these procedures.
So yeah, I think that was a very good explanation regarding this benign prosthesis implantation thing, because Professor has explained much more about what are the pros and also the cons of this concept, because according to the professor, he has explained much about it, and also the cost factor is the most important thing we need to know. And I think most of the Sri Lankan population, especially among the men, this concept is now getting popular and familiarized with them. So they would like to know further more about this condition. And I think Professor has explained in and out of it, and very precisely to the point what we all need to know. Maybe you have this issue. Maybe you need to know further more about it. So that's why we are forming these with our Professor Ajith Malalasekara regarding this topic. So, Professor, regarding this cost factor as a country like Sri Lanka, so what do you think in the future of this concept? Will there be any new methods for adding to this condition, or this is like this?
Yeah. As we move on further day by day, the technology of the instrument that we put into the patient, that is where I think we can make further improvements. The ability to simulate the actual erection that a man has, which is a very complex and a very interesting topic by itself. But I think the main areas of interest will be, firstly, the improvements in the technology of the instruments itself. But taking another step backwards, obviously the other thing would be looking at prevention, like improving our lifestyles, preventing diabetes, preventing hypercholesterolemia, stopping smoking, and obviously preventing injuries to one's spinal cord, etc., etc., avoiding those kind of risk factors which can lead to erectile dysfunction problems.
So we came to the end of this conversation, Professor. I would like to know, so what is the message you want to give it to the society, especially for the men who are having this kind of issue, who don't want to come up and talk about this issue mostly? What is your last message for them?
Yes, I think people need to realize that erectile dysfunction is a very common problem. It is not something that one needs to be ashamed about. Just like mental health problems where people hide at home, don't come out with it, these men's health problems, especially erectile dysfunction, is something that people need to come out with and seek help. And I think there are many consultants in our hospital in different aspects, the endocrinologists, the psychotherapists, psychiatrists, and of course us urologists deal with this very exclusively and very confidentially. That is the key thing. So what patients of this with this problem need to do is come out and seek help. I think that is the first and most important step that needs to take place. Then secondly, the important aspect to realize that there is a vast amount of treatment available out there, starting from the simple tablets to injections to vacuum devices and to our hospital-based the low-intensity shockwave treatment. And of course, we have the final treatment also available, that is penile prosthesis implantation, which is relevant in a very small group of people. But in those group of people who have failed every form of treatment, that is possibly the only form of treatment. And if the patients are selected properly, and if we are able to carry out the procedure successfully, the results, the satisfaction rates among patients and partners is over 90%.
So it's very interesting topic today. We have spoken with our guest professor, Dr. Ajith Malalasekara. I think today's discussion was very informative and very useful for your day-to-day lifestyle, especially for the men's health. Maybe you are very concerned about this condition. Maybe you are having this condition, maybe not, but you have learned something from this conversation which is very useful for your day-to-day lifestyle. So again, I would like to thank Professor Ajith Malalasekara, who participated today for our discussion and for your valuable ideas regarding this topic. So yes, I would like to thank everyone who have joined with us today, and we will see you soon. Have a good day.